Believe it or not, and I did not expect this, but I partially thought, okay, it's the Olympics. Chloe Kim, she is going back on her snowboard in the Olympics, and she's gonna compete. I'm Doc Faisal, orthopedic surgeon with Move Smarter Health. We are sponsored by an educational grant from Kinesi Movement. I love sports, I love talking about injuries, I take care of shoulder and knee injuries, and I operate and treat on them, and please consider this an educational, informative video only. Here we go. Amazing. So, she had a dislocation. She got her motion back. She decided based on her strength, she's just going to go for it. Is she at a higher risk of repeat dislocation? Yes, I can comfortably say that just in general based on the scientific data. Is Chloe Kim necessarily going to redislocate? I can't say that. I don't know. But the odds based on the statistics and the data are her risk of redislocation is higher. She's doing an impact sport, and that is the risk. However, that is just kudos to her. Go, Chloe. Bring us the gold with a dislocation. Man, that would be amazing. That's like super athlete level. She will just launch up there all over the news if she does this with a recent dislocation of her shoulder. Amazing, amazing. And and that goes to show, we're gonna have another segment on all these incredible athletes that do recover so quickly. I mean, I've had the experience of, some young athletes that came back and did some amazing things, even outside. I mean, I recommended not to do what certain kids that I treated did. And talked to their mother or their parents and said, yeah, I don't recommend this. And the kids did some amazing stuff in gymnastics, and we'll do a whole segment on that. And I think, maybe Chloe Kim's going to be that super athlete, super young athlete who comes back with a dislocation, no surgery, does the Olympics. There she goes.
What is she doing between now and the Olympics to prep? I mean, from the injury to the Olympics to prep her shoulder to be in the best possible shape it can be?
So that's a great question. Like, what the heck is she doing right now? Well, the biggest thing is you want to control the inflammation. So you want to do everything to get the inflammation down so you can get your range of motion back. The toughest part is this position. So is she going to wear some kind of brace that prevents her from going too high? I don't know. It's possible. I think it's going to limit her in terms of when she's moving around to have any kind of a brace. So I say that unlikely, but she's going to work on her strength, her rehabilitation. Now the shoulder went out the front. So she's really going to focus on balancing and stabilizing the shoulder with the neurokinematic rehabilitation around the shoulder kinematic. So she's going to work on her posterior cuff. She's going to work on her stabilization of her anterior and posterior and inferior shoulder kinematics. She's going to stay within the safe zone, and the safe zone, when I describe it, is within the 30 to 45 degrees. You don't do this. That's not a safe zone. So for what the Olympics are, just over 6 weeks away, right? Or less than that now, right? Yeah. So for the first couple of weeks, she's going to do this. Now, let's just take a step back. If she were a 50, 55, 60-year-old patient with a fresh dislocation, let's assume no rotator cuff tear, okay? What are you going to do? You're going to immobilize them barely. You're going to sort of put them in a sling, let them get comfortable, and you're going to start getting them out of a sling within a week, 2 weeks, 3 weeks. Because they're not playing at that level with impact sports. So you want them to mobilize early because the older patient, I'm not going to say geriatric patient, but the older patient, so because I'm older than 40, that's all I'm going to say. And so I'm not a geriatric patient, but I'm probably older than you think I am. However, if you're older, then you want your mobility because otherwise you will get really stiff. And so if you go through that protocol, then you're going to work on muscle strengthening, proprioception, rehabilitation, and really work on that. And that's going to be the key. And then you got the whole nutrition aspect. We talked about that with Jimmy Butler video, and we're going to do an entire segment in the off season all about nutrition, and we'll actually get some guest speakers on about that. So She's going to be doing whatever it takes. And then there's going to be a bunch of things that some of these private trainers are going to work on, really focused kinematics to really, like the therapist is going to say, okay, I want you to work on this muscle. I want you to work on this muscle. Now just remember, isolated muscle kinematics work in some respects just to kind of get the brain working, but you have to think of the body as a whole. Remember, fingertip to shoulder to spine to pelvis to legs. Everything is in a kinematic arc. So you really have to stabilize everything. And your core will matter just as much. And there's the psychological gap, confidence gap, all of those things. Now, obviously, she's got the confidence. She says, you know what? I'm going to do this. She probably got multiple opinions about her shoulder and decided she's just going to do it, get the surgery afterwards, and take that risk. Because the Olympics, why wouldn't you, right?